Still to come, preparing for flu season. Baptist Health is here with everything you need to know about getting a flu shot next. Welcome back. Summer is about over, and yes, we are planning ahead for flu season. Here with everything you need to know is Baptist Health's Dr. John Allen Cockrell with Sherwood Family Medical Center. Doc, thank you so much for being here.
Yes, sir. Happy to.
So the age-old question, does the flu vaccine actually make people sick?
Absolutely. So we'll start right there. Hey, welcome to flu season. So as with any vaccine, right, there can be side effects, right? But it doesn't actually induce the flu. The flu vaccine's inactivated, right? So I get it. People say that, right? And respect to them. But I think what they're experiencing more is the side effects from the vaccine doesn't actually make you sick.
Okay.
So that's hopefully good news there.
Okay. So who should get the flu vaccine?
Sure. So FDA, CDC recommends anybody 6 months plus, right, to receive the vaccine. If you're 65 plus, that puts you in a different, category. There's a high dose flu shot, just to let people know that at home. Some people don't. So ask your provider where you're getting your flu shot, depending on your age. But 65 plus, the high dose flu shot will be indicated for you. And
when should you get the flu vaccine?
Yeah, so September, October, here we go. I mean, we're kind of ramping up for it. So this is the time. This is the time. Flu season can extend, as everybody knows at home, all the way through March, even April sometimes. But getting it on the front end is still recommended. So sometime, now in the next month, next 6 weeks, would be recommended time to think about that.
And some brand new information coming out this morning that the FDA is saying that certain decongestants don't actually work.
Sure. So cutting edge here, right? And I give you credit for this. You're the one that brought this up, as well. So we were talking about this, backstage for a little bit, but to bring it to everyone. So pretty new news, I guess, if you can say that, about phenylephrine, which is what the active component of Sudafed is.
Okay.
So the FDA has studied this for a while now, but the report came out recently that said phenylephrine, that component, right, of Sudafed and other products too, really isn't any better than placebo.
Wow.
So interesting there. That does not include antihistamines, nasal sprays, right, or Mucinex. This is only for the oral form of Sudafed. Really doesn't seem to do a whole lot.
So does that mean that we should stop taking them? I know the FDA is going to look at, should they even continue to sell it?
That's the next, probably the next step, right, is to see, should this even be available? If it doesn't do a whole lot, are we really having it on the market for no reason? So I don't know that, obviously, but I think that's going to be the next kind of wave of questions about it. I know that if you're needing a decongestant, there's other ways to go about it. The nasal sprays, actually, to help with, the runny nose, the congestion, that kind of stuff, actually can be really helpful. Pause on that for a second, because Afrin, of all the decongestants, can only be taken for a few days at a time.
Okay.
But I'm talking more the nasal corticosteroids or glucosteroids, so Flonase, Nasonex, those are safer bets.
Okay.
So if you've got to grab something for nasal congestion, probably that, not so much the phenylephrine anymore.
All right, well, Doc, thank you so much for being here. You can contact Dr. Cockrell by heading over to Baptist Health by going to baptisthealth-.com or calling the Baptist Health Hotline at 1-888-BAPTIST.